As more businesses and institutions adopt COVID vaccine mandates for their workers, a new legal battle is emerging.
It pits public health needs against the First Amendment and the right to refuse the shot on religious grounds.
Yeah, to help us break this down, we're joined by NBC News legal analyst Danny Cevallos. Danny, good morning. So we've heard these reports of evangelical groups coaching their members on how to skirt these mandates. Now a suit has been filed on behalf of Maine healthcare workers, arguing the vaccine mandate violates their religious liberties. What are these groups saying?
They're essentially saying that the vaccine violates their sincerely held religious beliefs. And generally, these track two theories. One is under 1 Corinthians in the Bible, the notion that the body is a temple. Of course, the answer to that is, well, when was the last time you had another vaccine or a potato chip or a beer or a piece of beef jerky? If your body is a temple, then what exactly, how pure are the things that you're putting into it? The other position is that this violates sincerely held religious belief against using fetal tissue. And some of this fetal tissue dates back to 1985. But those are the two main tracks that the objectors, or the ones claiming religious exemptions to vaccines, are advancing.
So, Danny, what does the First Amendment protect, and how does that interact with public health measures like the vaccine mandate?
The First Amendment protections are so broad, they take up semesters of law school just on the protections contained in that one short amendment. However, we can whittle it down in this case to the notion of sincerely held religious beliefs. If a court ever reaches that issue, be warned that sincerely held religious beliefs can be very broad. They can be at odds with the main religion's tenets. But arguably, a court may never reach whether or not these folks sincerely believe that their religion prevents them from getting the shot, because the federal law prohibiting discrimination based on religious beliefs only requires a reasonable accommodation if it doesn't create an undue hardship on the employer. To use a silly example, imagine that my religion, I sincerely believe that working is a sin. Well, my employer is not required to accommodate that religious belief that I don't want to work. So there are limits, even to sincerely held religious beliefs.
So, Danny, you mentioned that a court may never be able to really determine if this is this sincere religious objection to the vaccine. But what's the process for trying to do so? I mean, how do they try to establish if this is true or if somebody just simply doesn't want the shot?
Here's the mission, and this has been in some of the documents by Liberty Counsel that they have sent letters to employers. And the idea is this, that this is a reasonable accommodation. And because of that, we do reach the issue of sincerely held religious beliefs. And they even have an answer to my beef jerky argument, which is, look, just because this person has had vaccines in the past, just because they may have had a pepperoni pizza in the past, and your body is not a temple with a pepperoni pizza, unfortunately. That doesn't mean that the next day they can't wake up and start fresh and be born again and say, look, going forward, I will only take pure things into my body. Then, of course, that raises the factual issue of, well, what are they taking tomorrow? I mean, did they have a pizza tomorrow? Did they have a beer in 2 weeks? Did they smoke a cigarette? So that idea of starting fresh anew every day may not hold water either.
There's a lot of questions here about what's pure food.
Exactly. And if you had it yesterday.
Yeah. Pizza doesn't count, Danny? Are we sure?
I hope it does.
Well, there's healthy pizzas out there.
Yeah, salad pizza. All right, Danny, thank you so much. Always good to have you.